Good afternoon, and thank you for joining today's NILE webinar. This is Brianne Van Dyne, the Education Manager for Immunize Nevada, and I will be today's moderator. Before we get started, I'd like to review a couple of housekeeping items. First, if we should become disconnected for any reason, please call right back and we will continue. Second, please locate the chat box in the bottom left-hand corner of your screen. If you have any questions, type them in the chat box, and we will address those questions at the end of the presentation. Lastly, if you've requested nursing or pharmacy continuing education credits for today's webinar, please make sure you complete the survey in the post-webinar email. The email will be sent out by the end of today, and all CEUs will be emailed out within the next week. Before we officially begin, I'd like to provide a little disclaimer. Immunize Nevada's NILE webinars are made possible by the generosity of speakers who donate their time and expertise to benefit the coalition. The expectation and goal is for community partners to gain knowledge on immunization-related topics through a non-branded, unbiased presentation. I'd like to now turn it over to our speaker, Dr. Nathan Boonstra, who is a general pediatrician at Blank Children's Pediatric Clinic in Des Moines, Iowa. Dr. Boonstra attended medical school at the University of Iowa Carver College of Medicine and completed his pediatric training at Blank Children's Hospital in Des Moines. He is involved with projects to improve vaccination rates across the state of Iowa, as well as on a national level, and has a special interest in using social media to dispel myths surrounding pediatric vaccinations. In 2014, Dr. Boonstra received the Childhood Immunization Champion Award for the state of Iowa from the CDC, and in 2015 was recognized by the Iowa Department of Public Health with an Immunization Champion Award of Excellence, and was recently the keynote speaker for our 2018 Nevada Health Conference. Dr. Boonstra lives in Urbandale, Iowa, with his wife and 2 boys, and he can be found on Facebook and Twitter, as well as at his blog at pedsgeekmd.com. Thank you, Dr. Boonstra, for joining us today.
Thank you, Brianne, for that introduction, and thanks everybody who's listening. I took a look at my weather app because I like to know what it's like for the weather of the people that are listening to me, and thank you extra if you took time off from a lovely day to come and listen to me. But I see that we're kind of in the same boat with temperatures in the 30s for both of us, although I expect it's a little nicer down there. But thank you anyway for being willing to come and listen to this talk. I appreciate that you've taken the time. I really enjoyed the opportunity to speak at the Nevada Health Conference, and I'm pleased to be able to share some of that information again today, although I'm going to focus a little bit more specifically on immunizations. What I want to do today is to have everybody think about your area of expertise when it comes, or your area of interest and your area of education when it comes to immunizations, because that's going to be very important as we talk today. That's going to be your wheelhouse, and that's going to be how you're going to contribute to better children's health when we start to talk about advocacy. Our objectives today are to take a look at parents and how they use the internet and social media for medical information. We're going to look at this information gap because there is a decent gap that exists between what we know as people who work in healthcare, in public health, etc., a gap between that knowledge and parents' knowledge in the age of social media. We're going to look specifically at social media and how it can be used to promote immunizations, and we're going to talk a little bit about guidelines for advocacy when you do social media and real-life advocacy, as well as how to take your first steps into doing advocacy if you haven't already. At the end, I think there's going to be, I'm excited for the time that we'll have to answer questions and have discussion. After that, I don't have any relevant disclosures to report. I don't receive any money from pharmaceutical companies or anything else to report like that. There are a lot of things, certainly, that pediatricians do when we talk about advocacy and we talk about looking out for children. There are a lot of things that you all do, whether you're in public health, whether you're in nursing, whether you're in any of a number of specialties that have to do with health. There are so many things that we advocate for, even if it's just one-on-one to a patient or client. There are things like car seats, there are bike helmets, there is adverse childhood experiences and toxic stress, there's smoking, there's safe sleep, there's healthy habits. All of these things are so important to advocate for. But probably there's nothing that is more impactful for me as a pediatrician. One of the most impactful things that I know that I'm doing to protect a child's health is to talk with them about the importance of immunizations and immunize children. And it's interesting because it's one of the ones that is most reliant on the community as well. We can't just rely on ourselves to immunize one person to protect that child, because the nature of infectious disease is that it can spread throughout communities. It can affect people who are medically vulnerable. It can affect the small percentage in whom the vaccine didn't work. And so, although in many of these advocacy areas it does take the community to make change, it's certainly true about toxic stress, that's certainly true about smoking, etc., and there are ways that the community can impact all of these. I feel like there are none so directly as with immunizations and the prevention of infectious disease spread. And so we all really do have to do our part, not just for the individuals that we work with in our jobs, but also with the community at large. So a great example of that is measles, of course. And you guys in Nevada are similar to us in Iowa from the news reports that I've looked at, and I'm certainly no expert in the situation in Nevada, but it seems like occasionally you get some cases of measles, but I haven't seen any major outbreaks the way that they have had in some of the other states. And that's actually been true about Iowa as well. Unfortunately, that's because of good immunization rates when it comes to measles. But when we look at historically how measles has been acting, there is cause for concern. There's cause to recognize that we as a community have to come together to prevent measles outbreaks from happening, to prevent children and other people from getting infected and potentially having a bad outcome. When we look historically at measles in the last couple of decades, we see that, as some of you may know, in the 1990s, when measles was still endemic in the United States, there were actually tens of thousands of cases prior to 1994 and some large outbreaks in urban areas of the country. We managed to curtail that by adding that second dose of measles, mumps, rubella, and then by 2000, measles was eliminated from the United States, and that was fantastic. And you can see there for a few years where things were really pretty hunky-dory in terms of measles in the United States. Yes, there were outbreaks. They were all being brought in from overseas, but from 2000 to about 2007, it really seemed like things were under control. Then 2008 happened there, and you can see that there's a little blip on the scope, but who knows exactly what that would mean. But then in 2011, a bigger blip, 2013 and 2014, and that's where we're moving into the the last few years, where we've seen the Disneyland measles outbreak, where we've seen in Minnesota outbreak among a vulnerable population, where we've seen now in New York and in the Pacific Northwest larger outbreaks, and they're increasing. And as you know, measles is the most contagious, or at least the contender for the most contagious illness on the planet. And as we see outbreaks of measles coming, we start to suspect that we're having trouble as a community maintaining good immunization rates, and that community immunity, or herd immunity as we call it, is starting to break down. When we look at the data on that, we start to realize that it's not as if measles vaccination rates across the country or even in any specific state are declining over time, but rather that despite efforts that we've been doing to improve immunization rates, it's areas that are clustering together, areas of states that have low immunization rates that then contribute to these large outbreaks that give us more and more measles cases here each year, and are starting to undermine the efforts that we're doing. So more effort from all of us is unfortunately needed. And that kind of goes along with the fact that we are starting to see a couple of things. We notice that although immunization rates for any given immunization are the same, are relatively stable on a national or even sometimes often a state level, we do start to see this clustering that I mentioned. We are starting to see an increase in fully unvaccinated kids at around up to age 35 months. So the National Immunization Survey that reports that each year. For the first time in the last couple of years, at least that I've seen, we've started to break that 1% fully unvaccinated barrier, according to that survey. But we're also starting to see a lot more exemptions in school. That's certainly true about Iowa. Here in Iowa, we do not have philosophical exemptions. We have religious and medical exemptions, but those religious exemptions are increasing year after year. So there's definitely increased refusal of a variety of vaccines. And that is probably why, even though those state-level immunization rates are pretty stable, when we see increased refusals and they're concentrated in certain areas, that's why we start to see these outbreaks in certain areas of the country. So I'm going to shift a little bit. When I was in medical school, I first got interested in this topic. And that happened because I did an away rotation in medical school down to an area of the state where there happened to be fairly high immunization hesitancy and refusals. And I didn't really know this going in, but when I was working, or when I was a medical student at a clinic with my attending, and I went in and I saw some families. One particular family sticks in my mind when I suggested, I think I had the inkling from the nurse going in that this family had already maybe refused some vaccines or whatnot. When I brought it up with the family, I didn't just get a no. I actually got a fairly aggressive no. Like the dad was upset and told me how much he disliked vaccines, and I was taken a bit back. It was one of those moments as a meek third-year medical student where I kind of said, okay, I'll let the attending handle this, and then slipped out. But it was kind of on my way carpooling back to Iowa City where I was talking with my friends and saying, where does this come from? I really need to dig into this and figure out where are families getting this information that's making them make these decisions. From my perspective, and having at least done the level of reading of a medical student, these vaccines seem very safe and effective. It really seemed like a no-brainer to immunize. How can somebody be so vehemently sure that they should not immunize? And that was really quite perplexing for me at the time. So I started doing more and more reading of the sources, and trying to figure out trying to read the sources that I felt like these parents were reading. And that is kind of close to that 2001 time period right here that we're looking at on the screen, where according to Pew Internet Research in 2001, about 34% of parents were using online sources for medical information regarding their child. Today, unsurprisingly, virtually everybody uses online sources for medical information regarding their child. But even back in the early 2000s, about a third of parents were doing that. And it's interesting, as I put together this talk, this kind of rule of thirds, a third this and a third that keeps popping up. You'll see that throughout the talk. But that has definitely changed. Everybody goes online for medical information, and even everybody goes online for medical information regarding their kid now. So where are they going? They are going largely this is also not surprising. I hate to say this, but quite a number of things I'm going to present today are probably not surprising in the age of internet and social media that we're in. But most parents who are going online to get information for health, to get health information for their child, they are not going directly to their doctor's website if they have one, or their children's hospital in town. They're not going to my children's hospital. They're not going to the University of Iowa here. They're not going to hospitals or directly to those websites and doing searches in those sites in your state either. they are going to naturally Google or similar to find out their health information. And maybe a minority of them go to an already established website that is known for health information, and then doing a search in the search engine on that website to find out what that reputable source says. And what are they looking for? Basically, it breaks down into food, drugs, and shots, frankly. These are the top 3 things that parents are looking for regarding medical information for their child. A good 70% or so are basically want to answer the question, what should I feed my baby? What should I feed my child? 67% of them, 2/3, want to find out either what can I give my child for this symptom, or is this medication that my doctor prescribed safe to give? And 1/3 of parents, so relatively small compared to the others, but 1/3 of parents that go online to look for medical information for their children are looking for information on vaccines. Now, when parents go online to look for information on vaccines, it is almost a guarantee that they're going to run into anti-vaccine information. They're going to run into misinformation about vaccines. In fact, this same survey, I'm going to show this next slide, but it requires a little bit of explaining. So when we see, when all of those parents, of all the parents that are going looking for information on the internet, 1/3 of them are looking for information about shots, and of all those parents, 28%, so of all the parents that are actually looking for medical information, 28% of them find anti-vaccine information. And what that means is that virtually everybody who goes looking for shots finds some level of anti-vaccine information. If they're looking for information on shots, they're finding anti-vaccine websites, frankly. Interestingly enough, I like to throw this in there just to show how much parents use the internet to look up health information. 11% of parents searched the internet before they took their kid to an ER. And in this particular study, now this was 2011, so this was a little while ago. In this particular study, the top 2 websites that they went to were Wikipedia and WebMD, and less so CDC or the AAP's healthychildren.org website. So that kind of just drills in how much parents are using the internet for information. Now, I like to look at this in different ways. I really like, when we're thinking about, well, what sources are parents using, I also like to look at some of these studies that look at how good is this information that they get. Like, what are the outcomes here? So this is an interesting study to look at in that regard. It looks at people, this is not necessarily parents, but these are people who have symptoms of some kind, and then they go on to WebMD or somewhere else, and they diagnose, they're online diagnosers. They diagnose what they have and get themselves a diagnosis from the internet. Now, of those families, of those people who do that, if they went to a doctor then, the question that this study looked at was, did the doctor agree? Did this Googling, did they get it right? Now, 1/3 of them didn't really ask and didn't ask about the symptoms. Maybe it was minor stuff and it didn't really come up with a doctor visit or whatever. Or they didn't mention the fact that they had gotten a diagnosis. But of that 60% that did actually talk to a doctor about these symptoms that they were having, that they had already Googled and believed they got an answer to, about 2/3 of them, they actually got it right. They got it right by Googling it themselves. And about 1/3 of them, at least the physician, disagreed. Presumably they got the diagnosis wrong on Google. And that's really interesting. I think that's interesting both ways there, in that you can use Google to be right most of the time, but it's also frightening that a lot of people are going on Google to Google their symptoms, and they're getting it wrong at least about 1/3 of the time. So as we see, information, as we know, on the internet is quite variable when it comes to outcomes and how good of information we end up getting. That's true about safe sleep as well. Parents who go, in this study in 2012, they just did basically surveying websites when they used certain search terms, and they found when they were searching for safe sleep information that they're taking out the yellow part of the wheel because that was just stuff that came up that didn't have anything to actually do with safe sleep. But of the hits that were relevant, 1/3 of them were inaccurate, and 2/3 of them were accurate information. So parents are getting exposed regularly to bad information, kind of regardless of what they are searching when it comes to medical information. This is supposed to be a video that I think does not work, but in this video, you may have seen it. It's a really good short. It is basically if Google was a person, and this is a mother who basically verbally tells Google that she wants to do a search for vaccines cause autism. And the Google person says, well, I have 1 million findings that say they don't, and 1 finding that says that they do. And she grabs that and says, I knew it. So that's kind of a segue into social media, because social media is different than the internet at large. We've been talking a lot about the internet at large, in which usually, now of course this is dependent on search engine algorithms and whatnot, but parents are doing a lot more going out and seeking the information on a website and then hunting around for that. Social media is a little unique in that you go to your social media feed and the social media will come to you. The information will come to you and be pushed to you in a quite different fashion using a different algorithm than the internet at large and search engines and whatnot. And so it's very easy for somebody to be pushed that one study or that one paper or that one reputable looking website that claims that, say, vaccines cause autism. And of course there's more than one out there, but that relatively small and not done by expert website that's out there, number of websites that are out there, and not see the overwhelming amount of evidence that show that vaccines don't cause autism and that show that vaccines are safe and effective. When we look at social media use, this is from 2015, so a few years ago. I think this is probably an underestimate compared to present, but the Pew Internet research from 2015 says that about 66 adults in the U.S. use social media, 75% of parents. I think that's, of course, approaching 100% as we go on in time. Of those who did use social media for the purpose of looking at medical information, 79%, or who got medical information from social media, 79% of them said that they found useful information. 42% of them said they received social emotional support from social media. This is one of those good things about social media, that it's possible for people with maybe who have children with special needs, who have children with rare diseases, who themselves have unique medical needs, to be able to find social groups, support groups, information about their situation, be connected with other people, and all kinds of benefits to that. But on the flip side, it allows for people who believe something specific to gather and be in an echo chamber and not get information that challenges those beliefs. And we see that, of course, with groups when we talk about vaccines and vaccine safety. 31% had parenting questions answered by using social media. And 59%, about 2/3, felt that when they used social media to find health information for their kids, they found useful, specific parenting information. So the upshot of all this is that not only do parents use social media, they really do feel that it's valuable. They believe largely that the information that they're getting from social media is valuable information. And we know that that is not always the case, that information can be of varying quality. What are they using? Unsurprisingly, most parents are using Facebook. This is all kind of to scale, so it's about 75% of parents in that survey in 2015 were using Facebook. Again, these dynamics may have changed over the last 3 to 4 years. 25% were using Twitter, 25% Instagram, and then lesser amounts of Pinterest and LinkedIn. Other social media sites were not used as commonly among parents. Of course, there's a lot of social media sites that are used among younger generations, and those are undoubtedly increasing as those younger generations become parents more frequently. But this is probably roughly what we're looking at right now. Quite a lot of use of Facebook, and then a fair amount of use of Instagram and Twitter. 75% of parents said that they use social media daily, and 51% said they use it more than once. So to reemphasize, it's frequently used, and frequently used for parenting information and health information for their children. Now, as I alluded to earlier, parents are exposed, when they go looking for information on vaccines, they are almost certainly going to be exposed to poor information about vaccines. And in fact, in general, using the internet to research vaccines, at least in this study in 2012, was associated with decreased perceived vaccine efficacy, decreased perceived vaccine safety, decreased perceived, they were not as likely to believe that their child was vulnerable to the diseases that are prevented by vaccines. There is a little bit of a chicken and egg situation here. Is that because they already had that in mind and were just less likely to believe vaccines were good, and that's why they went hunting? Or was it the information itself, or is it both? So what do we do about this? What can we do? Obviously, we need to make sure that there is good information on the internet and on social media about vaccines. And there are a lot of groups that do that. There are clearly many, many, many groups all over the internet that are producing good information about vaccines, not the least of which is Immunize Nevada. But that does not automatically mean that that information is getting into the hands of the people that need it the most. And social media being the way that it is, the algorithms being the way that they are, social media is not necessarily going to put it into those hands. And there's a lot of discussion right now. It's really pretty exciting because there's starting to be some pressure on social media to change those algorithms, to make it so that accurate information about vaccines is more heavily weighted, and to make it basically so that information that endangers children really has less of a place. I don't know and cannot predict how those talks and whatnot are going to go, or what changes will be made. So in the meantime, it is kind of on all of us to use our own social networks to help make sure that good information is disseminated. This is a study from 2013. This looked at people who chose to vaccinate and people who chose not to vaccinate. This doesn't just look at, this is not specifically about social media networks, but this is about a parent's social network, all the people that they come into contact with. And it was found, again, not unsurprisingly, that if a parent was surrounded by people largely who don't vaccinate, that would be the left set of, that would be the social network on the left there. If they're in the middle of that, then they are less likely to vaccinate. And if their social network is largely populated by people who do vaccinate, and they perceive that as normal, and they interact with these people, and they know that they immunize, then that parent is much more likely to immunize. So what I want to be able to do is to be able to put us as people who, this is a, you may not wear a stethoscope around your neck, but that may still be you. You're the person who has expertise in this area, and you have a social network. And by being in the middle of this social network, you are contributing your voice to make sure that the people are hearing from, make sure that people in their social network are hearing from people who are immunized, are hearing from people that they respect and know have education and expertise in this area, and are hearing from people who are portraying immunizations in a positive light. And that can make a difference. Now, that starts the discussion of advocacy. And one of the things that I, as a big geek, I like to bring up the fact that when you are deciding to do some advocacy, it does not mean that you have to bear the entirety of the one ring around your neck and take this up to and go into where it is difficult to advocate and advocate against the most difficult, in the most difficult situations, and this is your charge, and you're just the hobbit who everyone is dependent on. That is not how this has to go. There are actually quite easy steps that you can take to start to add to that conversation. Keep in mind that, as we saw in that, as in that slide earlier, you are one person in many people's social networks. And to many of your friends, they're looking up to you and your health expertise in a way that they're not looking to their other friends. So you may have more influence in this particular area about immunizations than other people do. But you don't have to do everything yourself. You can take some fairly simple steps to start and add advocacy into your daily life and into your social media, your online life. So the first thing that I would recommend is that you advocate for what you enjoy and you're passionate about. Now we're talking about vaccines today, and this is all about your area of interest with vaccines, and maybe that's everything when it comes to vaccines, but maybe you have you almost certainly have areas in which you are better educated, areas about vaccination in which you have more expertise than other people, even other people who know about vaccines. So whether that's your knowledge of how public health works, how systems work, how if specific vaccine, you know more about HPV and cervical cancer, that may be your wheelhouse. If you have worked in situations where outbreaks are contained, if you know a lot about influenza or have personal experiences with some of these diseases and the damage that they can do, these are your wheelhouses, and these are the things that you're going to be able to have the most compelling stories about. So figure out what that is. And that's an area that you might start. When you do start to do advocacy, start with that area. And I was supposed to show that picture while I talked, so I'm just going to move on from that. Second one is to find role models, people who are already doing the work of advocacy in your area. So if you're in public health, I highly recommend this, and everybody can just go ahead and do this right now. I'm not actually going to wait and allow dead time on the air here, but you should think about getting a Twitter account. If you're in any of these areas, public health, you're a physician, you're a nurse, there are advocates out there that you can connect with, and almost certainly you'll find them on Twitter. And when you start to follow people, they can direct you to other people who do advocacy really well. And you can see the kinds of things. Not only can you learn from them, you can see the kinds of things that they do. Twitter is kind of an advocacy hub in that way. And you don't have to start by tweeting or worrying about how the system works, but if you just start to follow people and reading your feed, you'll start to absorb a lot of that information about how advocacy can be done and learn from people. Even if you're not ready to produce content, you can start to consume content that other people are making and see how it's done. So if you got your phone out, it's not too hard to do. You can get on Twitter right now, and of course if you do, please give me a follow. I'm at Pete's Geek MD. Advocate personally and publicly. So there are kind of two avenues you can take when it comes to advocacy, and I think they are both important. I think it is important for people to put out information that is consumed by the public at large. And if you have expertise in vaccines, then you can do that. Either maybe you already have something set up that your institution does some social media and you can help contribute to. Maybe you want to set up your own professional page that's just you, but you put your degree on there, or you call it something. I'm moving ahead here, sorry. So this would be an example of that. So I use a professional page where I post things once in a while. I'm not posting these days as much as I should be, but I've been a little busy. But I do immunization information on a regular basis, along with other childhood health matters. But you can also, so that is one thing to consider. But even so, just doing advocacy on a personal level, I think is underappreciated. So again, you don't have to bring the ring to Mordor. If you feel like making a public page is bringing the ring to Mordor, think about instead, every once in a while, advocating to your circle of friends. And again, when we talk about that, you don't have to be pushy. The important thing here is not to convince people and change their minds. The important thing is to add to the conversation. I'm going to talk a little bit more about that. But it's important to keep in mind that that can be real life, mentioning vaccines in conversation, talking about, did you hear about that outbreak on the news in Washington and Oregon? I'm so glad that we're not seeing that in Nevada. I really hope that we can make sure that kids get their vaccines so that that doesn't happen. You don't have to be. So again, we're doing this. This kind of refers to not needing to bear the one ring. You do not have to be the most prolific and eloquent author in the world to be able to do this. And this is supposed to be an animated GIF. I don't know if it'll suddenly start to animate at some point if it sits here long enough. But Kermit's supposed to be typing away at that typewriter as if he's writing a grand epic. You do not have to write a grand epic when it comes to advocacy. And there are nice little tools and things that you can do to help make it easy. But the easiest thing is to simply share good articles. And if you're on Twitter, you're going to see those things that can be shared. And you can simply say, you don't have to write a great deal, but you can simply say, here's an article on that measles outbreak in Washington. This is scary. Everybody, please vaccinate your children. I believe it's very important. And that's really the message. Right there, you have, as a person who, in your friend's eyes, has expertise on this, you have said, this is very important to you. You might have said, I am so glad that my kids are immunized, and so you've normalized it for people to be immunized. And you've kind of put yourself out there and allowed your social network to see that this is something that's important to you, and they should. And a lot of times, that's going to be influential in their minds. And there are varying levels to which you can, do advocacy. If you kind of start with Twitter, that's you only get 280 characters to say something, so you don't have to say a lot. If you're doing Facebook, you can say as little as you want and still be effective, like I just described. Blogging, of course, man, it's tough to blog sometimes and time-consuming. So if that's not not the level of advocacy that you're at, that's completely understandable. Because really, with that level of writing, that's going to be more public. That's not going to be to your personal social networks as much as when you post something to Facebook or one of your other social media feeds. You don't have to know every answer. Now, I love this cartoon. This is literally me. Like, you could just Photoshop my head onto that guy sometimes. But I try not to be that guy because you do not have to. You will invariably, if you advocate for vaccines, even if it's a friend who does it in kind of a friendly manner, you're going to get somebody who is questioning vaccines. You might get ones who are actually repeating anti-vaccine tropes. If it's public, you're certainly going to, at least at some point, encounter somebody who's questioning what you advocated for. The temptation, at least for me, is to be this guy right here and to go back and forth and debunk to the letter all of the concerns of the person. That is not something you have to do. First of all, knowing human psychology, that may not be the most effective thing anyway. We know that debunking often results in the person just digging in. But at the same time, there are other people watching. There are other people on say, your social feed. They're watching what you write. And so it is important to at least address things so that other lurkers are seeing accurate information. And often the simplest thing to do, especially if you don't know the nuts and bolts of that specific myth that's being presented, because there are as many myths out there as there are people on the internet. If you don't know exactly how to debunk a specific myth or how to address it, you can simply write, you know what, I hear you. I understand this concern, and that makes sense to me why you would be concerned after reading this. However, I have done a lot of reading on this myself, and I've actually looked at all expert opinion, and basically every expert on the planet agrees that this vaccine is safe and effective and a good idea. So I'm going to go with that. And that is actually a really good boilerplate response to almost anything, anytime that somebody is trying to argue about vaccines, and especially if it's on your personal turf, like your social media areas. You don't have to argue with everybody. You can simply say, I hear you, I acknowledge your concerns. This is why I think that what I said is still true, because it is agreed upon by actual experts on this topic. And that is a great, I think, way to address and not feel stressed out about people, what if somebody pushes back? It's okay. Lastly, use resources. There are some great resources out there that you can use. I love AAP, American Academy of Pediatric Resources. You can go to their website. I made a little tiny URL there, so if you want to go to tinyurl.com/AAPSM Toolkit, that's AAP Social Media Toolkit, you can see the stuff that they have, and that includes just sample Facebook posts, sample tweets, good websites to go to for one-pagers to use for myths. Like somebody's asking about egg protein in the vaccine. Somebody's asking about vaccine ingredients. There are good one-pagers out there for that. So you don't have to do it all yourself or come up with all of your own material. And then there's a few good guidelines to be thinking about. As I mentioned before, you're going to bring your expertise. You're going to really focus on the areas that you're the most comfortable with. And you can always extend that to vaccines at large. So even if your area is vaccine storage, saying, I'm excited about, I don't know, new development in vaccine storage, I think that this has the potential to make sure that the vaccines that we give children are as effective as they can be, because that is so important. That is the way that you've just brought your expertise into the larger conversation. It's important to adhere to the guidelines of your organization, and just be aware it never hurts for your organization to know that you do some advocacy, and you can talk with them about any guidelines that they have. Many organizations, especially I think with what we're doing, I'm sure I'm talking to a lot of people that are in public health, a lot of people that are in healthcare. All of these, all the places that we work for should be supporting advocacy, frankly. It's important to be respectful. That's not to say that you can't have your own sense of humor and personality, but especially if you're representing an institution or you generally value your job, it's important to be respectful even when you get people who are not necessarily respectful to you if you are advocating to the wider global audience. Use a disclaimer. That's always a good idea. That kind of goes into the guidelines of your organization. So it may be that you need to put on anything that you're doing publicly on a public feed that your views are your own, basically. Of course, don't diagnose or give specific patient instructions. And that goes into number 6, that you should always consider HIPAA and be extra careful. It is very tempting for me to say, oh, I saw this today, even if I don't give any patient information, but that is still something that somebody might track down and identify. So be very, very careful. Know the guidelines for HIPAA for mentioning even anonymous cases and whatnot. I'm also just careful about acknowledging anybody. If somebody's a patient and they interact with me online, I'm very cautious about that, because I don't even want to acknowledge that somebody could be a patient of our clinic and whatnot. So I'm always very cautious about those kinds of things, and you should be as well. So to finish this up before question and answer, I love to post this photo, and there's a great story that goes with it. So if you don't recognize this is Elvis Presley, and he was part of a March of Dimes campaign to improve polio vaccination rates. The story goes, and there are, of course, a lot of other factors that went into making polio vaccination successful. But Elvis is actually, he gets a fair amount of credit for the impact that he had, because prior to this photo, and I'm forgetting the details, I feel like this was part of being on the Ed Sullivan Show, but I could be completely wrong on that. But prior to this photo and this campaign, there was sluggish uptake of the polio vaccine. And after this, a whole lot of people wanted to be like Elvis, and they saw the person that they respected, Elvis, and they said, well, Elvis is getting a flu shot. This must be okay. This is something that I want to do. And so you literally had teenagers initiating polio drives in communities to get people immunized. And so one person and his particular voice made quite a big impact. Now, none of us are going to be Elvis Presley. A few of us out there might be like Elvis Presley, but most of us, myself included, are not Elvis Presley. We're not going to have the audience that Elvis had, but we are actually looked up to by other people in our social networks. And thus, we can all do our own part to be our own little Elvis in doing what we can to improve vaccination uptake and looking out and protecting the health of children when we do our part in vaccine advocacy. So that is the end of my prepared talk today, and I think I'm going to pass it over to opening up for questions.
Thank you so much, Dr. Boonstra. We're going to offer a little bit more time for last-minute questions, so please type those in the chat box now. While we're waiting for those questions to be typed in, just a couple of reminders. If you have requested nursing or pharmacy continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar is ended, or will be included in a post-webinar email. The email will be sent out by the end of today, and all CEUs will be emailed out within the next week. And as always, if you'd like to view or share this webinar, the recording will be available on our website along with information for future webinars. Please visit immunizednevada.org/webinars for those details. And we do have a couple of questions that have come in. The first one is, with many state legislatures in session, do you have any tips about being an advocate for pro-immunization legislation?
This is a timely question because right now Iowa is facing what seems to me to be an unprecedented number of bills that have to do with immunizations. And in fact, we just recently had a bill that was in subcommittee yesterday to introduce philosophical exemptions to the state of Iowa. And fortunately, that bill was rejected out of subcommittee, and I was able to be in attendance at that subcommittee hearing and kind of watch that process and speak a little bit. I would not purport to be an expert in how to talk with legislators on vaccine issues. I can tell a little bit about what we've started to do in Iowa. And honestly, you guys in Nevada are far more organized than we have here in terms of pro-vaccine voices. I'm hopeful that that is going to change. But what we have started to do is make sure that our presence is known. So part of it is just getting together people who are of like mind and getting together groups to, in our case, we wrote a letter to legislators and had a lot of groups like public health associations and the varying hospitals and clinics and whatnot in Iowa to sign on to it. And that was a general support of immunization. That wasn't specific to a bill. But I also think that it's, I mean, as you would expect, calling your own legislators is very important. The language is important. So I think that it's worth getting together and looking to your advocacy leaders at Immunize Nevada and finding out when it comes to a specific bill what are the most important talking points. So, for example, there was actually with this philosophical bill, the philosophical exemption bill, it was very easy to point to the outbreaks. I don't want to have outbreaks to point to, but they're there. I immediately, when I talked to some of these legislators, went to listen. There's measles in the Northwest. There's measles in the Northeast. There's measles in the Northwest. We do not want measles in the Midwest. And that was a very simple thing to say, to repeat to legislators, effective. And so I would look for those talking points. Getting into the weeds too much isn't necessarily convincing to a legislator. They're not going to, they don't need every detail. They are not in that. They're a lot of times anyway, don't have a background in this kind of thing. They need things that are relatively simple and to understand. So those are some tips that I have, and I expect Immunize Nevada has a lot more tips for you.
I think this is a good opportunity to point everyone, even if you're not in the state of Nevada, to take a look at our advocacy toolkit page on immunizenevada.org/take-action. It talks about just some real tangible things that you can do, whether it be in Nevada. There's some of this that is Nevada specific, but also just in general in your states that you can do to be an immunization advocate. I know that our bills here in Nevada have the opportunity, as I think all legislation does, to and opportunities for public comment that you can submit not even during the live session itself. So you can search the bill on our legislature's website and then demonstrate your support there. You don't even, on our site, you don't even have to write a narrative as to why you're supporting it. You can just say that you are in favor of a pro-immunization bill, and that counts. It's not nothing. Or if you feel so inclined, you can write why it's important. So I think that is a couple of tangible things that you can do. So if you go to immunizenevada.org/take-action, it'll walk you through that, and then it also provides links to our advocacy action list as well. And then there's another question that came in asking if participants could be provided the links to the specific studies that you reference in your presentation. Dr. Boonstra.
Oh, I'm sorry. Can you repeat that? I didn't
Sure
quite hear that
thing.
part.
We had a request for the specific studies that you referenced in your presentation. If we could be provided with those and then send those out to participants.
Yes, I can certainly do that. So, and some of them, I know that I did kind of shorthand notation for a lot of them on the slides themselves, but absolutely. In fact, what I can do is prepare a document, probably a Google document that has them all. And then if we can get that link sent to the participants, then they can take a look at those.
Great. And we will be posting the slides as well as the archived presentation, like I had mentioned, on the Immunize Nevada website shortly after we conclude today as well. And it doesn't look like there's been any other questions that have come in. If you do have any questions that you think of post-webinar, please let us know. Send us an email at info@immunizenevada.org. Otherwise, that will conclude today's NILE webinar. Again, thank you to Dr. Boonstra and to those of you who participated. Have a great day.